Welcome, everyone. My name is Denny Brennan, and I'm the Executive Director of the Massachusetts Health Data Consortium. And I'll be your moderator today for our discussion with Jessica Zeaske from Echo Health Ventures on discerning value in digital health investments. We've seen a considerable amount of fundraising occurring in digital health, and we've also seen a fair number of good deals and a probably larger number of not so good deals. So being able to discern what constitutes one from the other is of real importance, not only to investors, but also to the companies who are looking to seek venture capital. Let me provide a little bit of pre-webinar information for you on today's event. First, we're going to be asking or looking for a number of key points, and we encourage you to type your questions into the question pane at any time. If you wish to raise your hand, by all means do that, and I will let you speak during the course of the presentation. We really want to have a back and forth here. The webinar is 60 minutes in length, so we're giving you back some time today. So we'll have, roughly 40 minutes of discussion, plus or minus 5 minutes, and 20 minutes of Q&A, which we will intersperse throughout the presentation. Our goal is to have more of a conversation today than to have a straight one-sided presentation. Today's program will be recorded and will be available at the end of today's presentation. Probably 24 hours afterwards. Give us time to get things put together and well polished for you. We have listed our social media contact information as well as Jessica and Echo Health. You can also see our hashtag MHDC Echo VC for those of you who wish to use social media. Remember that as you attend the webinar, that you can ask questions by typing them into the question pane or raising your hand. Finally, when you exit the webinar, you'll be prompted for a survey. We appreciate your taking the time to complete that survey and provide us your feedback on today's presentation. It's very important to us. And now it's my pleasure to introduce Jessica Zeaske, Managing Partner of Echo Health Ventures. Jessica serves on the board of Genome Medical, Eleanor Health, Heartbeat Health, and a number of other companies, and is a seasoned venture capitalist in the digital health space and a board leader, having worked at independent, corporate, and university funds over dozens of investments over the years. Outside of Echo, Jessica serves on the board of CareQuest Institute for Oral Health. She's also working on the board as a trustee for Boston Medical Center's Exceptional Care Without Exception Trust, and is an advisory board member of our members Boston Children's Hospital and a member of the National Association of Corporate Directors. Welcome, Jessica.
Thank you so much, Denny, and really appreciate the opportunity to speak today. I especially, it's so much more engaging when we do have audience participation. And Denny, I know you've already started gathering some questions, but when we do, we're talking about changes in the market, and right now, pretty volatile, rapid changes in the market. There's often a dialogue that starts to happen. Doing one stiff presentation is not the intent of this, but it is to have a lively chat in terms of questions that we're having. And I've given Denny for wait, time out, you're talking investor speak. That's a lot of acronyms, and we all know the acronyms in healthcare, but there's a lot of acronyms in the finance industry too, and so I'll try not to throw too many of those in. But what we're going to be talking about today is really, I'll do an introduction. Many of you have heard of, worked with venture capitalists, corporate venture capitalists, investors, startups, etc. I'll give you a quick overview of what the seat that I'm in, and a bit of an overview of the VC digital health sector as it stands today. Then we'll go through a few discussion points in terms of bullets that I've listed there. So to begin, what I want to talk about first is EcoHealth Ventures, the overview, and I'll start with our mission. And why this is important is because I sit here today and very proud to be a venture capitalist in this industry. It's all I've ever done, as you could hear from my intro. But I'm here to really grow and transform companies in the healthcare setting. And this is the mission of EcoHealth Ventures, that we want to be an industry leading investor, and drive strategic value for our Alliance members. But what really comes down to is, how can we use this data to impact lives and impact the patients, impact health plan members, and impact individuals for affordable. My original background is in public health, and I feel that it fuses so much with what we try and do through our work in data, through our work in public health, social justice, and data is really the tie that binds so much of that together, is how we can use that. It's why it's so important in many of our investments. So if we go to the next slide and we talk about EcoHealth Ventures, and again, I won't spend long on who we are, but we invest on behalf of 4 different Blue Cross Blue Shield plans. Blue Cross North Carolina, Cambia up in the Pacific Northwest, Arkansas Blue Cross Blue Shield, and Blue Cross Blue Shield of Tennessee. And why that matters, we have national coverage. We have over 10 million lives we invest on behalf of. We typically write checks between 5 and 15. We're a stage agnostic investor. And what that means is, again, with the jargon, it means that we invest in PowerPoint presentations and 2 people sitting in a, and essentially a whiteboard, and we invest in companies that are about to go IPO. What it matters is that they're really, again, they're going to be making an impact on the healthcare and doing transformation in the industry. We look at the strategic priorities of those blues, where the market is going, and we try and develop real relationships between the health plans and the investors. Now, we invest in providers, SaaS companies, platforms, insurtech, across the board of what we invest in, and I'll get to that in a minute. Our process, and many of you have maybe been through some of this process, is going through sourcing and diligence and how we get approval. And then, but we also spend a lot of time developing Eco Insights, and I'll talk a little bit about that. On the following slide, what we can talk about is, what do we have as our priorities? And when you look across this, you can imagine we call this the Big 12, and the Big 12 areas are where we really feel EcoHealth Ventures is going to be investing and spending our time outbound calling, sourcing deals. Now, you go across and there's, row 3, column 3 is, data analytic platforms for payers. That is, we talk about this today, the gold rush. However, it is definitely not, when we talk about data deals, that's not where they all sit. There's behavioral health solutions, pharmacy, novel care delivery models. They're a big part of the diligence and competitive asset, and moat, which is what we call the competitive boundary around these companies. We look at data for all of those. But those are really the priorities. Again, when we are focusing on building a portfolio of transformative companies, we look at companies in these 12 areas. We call, that's just our. One could ask us, those seem pretty wide, and that is by intent. It is so that when we also get a novel company coming in about, a new PBM, or which, is a pharmacy benefit manager, it's how a new way to lower the cost of prescriptions, or there is something in the customer service space, we've got room to navigate and look at some proactive areas too. But those are the priorities we look at. As I said, we have a fairly narrow scope in healthcare, in how we look at. We don't do travel. We don't do fintech. We don't do blockchain unless the actual deal is healthcare transformation. And that's part of why I love it. Go ahead, Danny. Were you gonna?
Jessica, I was just going to ask you a question, which is, in the last 12 months. Have you seen among these 12 investment areas, this portfolio, priorities, where have you seen the greatest shifts? Where have ones ebbed in sort of popularity, for lack of a better word, and where have they grown?
So let's the focus of where they're, where are we reprioritizing a few things in down markets, which is what we're in and continue, expect to be heading into in a little bit for a little bit longer. There's a higher value placed on short-term customer ROI, and the payback could even be as quick as 12 months. So if I put this piece of software, if I put this intervention in place, can I be paid back in 12 months? In up markets where their cash is a little more fluid, you could say maybe it's 2 years, maybe it's 3 years you're getting that ROI. And so what we see is that ROI push moves us to a few more infrastructure and data deals rather than, so if I look across this, novel care delivery models, fantastic. We have a lot of those in the portfolio. Companies like Dispatch Health, that is an emergency room. Think of it as an emergency room visit, but you could do it in your home, and really helping people get care in their homes. That is an immediate ROI. A health plan can see savings from that and get better care by implementing that model today. So that one could be purchased right away. If we have a kind of a PowerPoint for a new level of AI that may take a year to get the data streams and then reanalyze the data, and then it's going to help with I'm not going to use a use case right now, but for that's going to take 2 to 3 years. Those are just harder sells. And so I would say the later stage novel care delivery models that have some proving are increasing in interest. Things on the bottom row, which are, I would say, more on the administrative side, that are going to have that faster ROI or proven ROI, are a bit more compelling if we're looking at a new investment. Now, again, we'll look at the early stage stuff still, but there are certain ones that are just unfortunately not going to go away. Behavioral health solutions, I don't care what the market's doing, we need more solutions in that space. We need more solutions in pharmacy triple aim. And that is, again, people on this call know what a triple aim is, but that isn't clinical trials. That is really addressing the cost and availability of necessary drugs to the population. And I think that those near-term, just pressing priorities, unfortunately, just remain there, and with greater awareness than ever before.
Terrific. I have other questions from our audience if you would like me
Great.
to ask those of you now.
Yeah, please do.
We have a question from Irving who says, how big is your portfolio in the number of deals and their average size?
Yeah, so let's go ahead to the next slide, please. So this is the, our portfolio right now. It doesn't have all of our alumni companies on it, but this is our investment. We typically invest 5 to 15 million in the first check we write to a company. We lead or co-lead deals. We can follow on, but because our structure is built with a lot of strategic engagement, it's typically we're very active with the portfolio companies we invest in. And that is, Danny, a question that I think entrepreneurs should always be asking who they're interviewing and doing diligence, because it's a two-way street. I'm doing diligence on companies, but companies should be doing diligence on us as a fund. What do you typically do as your follow-ons? How involved are you? Do you have proof points, impact that you've made on your portfolio, and where will I fit in the portfolio? Those are all great questions to be asking, not just, hey, do you want to invest in my company? These are long relationships I have with the companies that we invest in. We serve on the board, we get very close to the management teams. And so doing it that two-way street is very, very important.
We also have a question from Bob who asks, how is AI as a technology, as an approach, in a part of your portfolio, and he specifically references voice-focused AI for
great.
example.
So we have looked. So then, let me come back kind of to a first principle around investing. We don't, unfortunately, have a. I would, if we go back to the last slide, please. I would put some of the voice AI where we've been evaluating opportunities in the member and customer service and engagement space. There are companies out there that, again, not in our portfolio right now, that are doing robot process automation to make customer service better, to make member engagement better. Who's in my network? Is this doctor in my network? Is this? Those are all really important voice from the administrative side. But then also from the clinical side, is it what is the engagement that an individual could have? We often talk about elderly individuals who can have medication reminders and have voice help. And please know, I'm nuancing the difference between machine learning and and the responses, voice responsive, and probably what you're talking about, which is really cool AI. So there are places we see it fit. At this point in our portfolio, I wouldn't say any of our portfolio, which is on, if we can forward to back to the portfolio slide, highlights AI as their tagline. Our portfolio, you're really going to see them solving today's problems, and unfortunately, some of those problems are based on very old technology. IDEON is an example that helps individuals enroll in health insurance faster. Now, would it go better with AI? Probably, but we're still, EDI I'm sorry, I keep forgetting, everyone on the call knows what an EDI is. So these are EDI, very simple transactions. We're trying to just get those right. And so AI, it's a little early for AI in that space. I would say one of our portfolio companies, GNS Healthcare, is absolutely, in the true definition of AI, using that for drug discovery, for and helping understand the impacts of different clinical interventions that could be done a bit more on the pharma side. They do other things that are associated with the administration, but that's an example of a company that I would say, yep, they are technology first AI. But the majority of them are trying to solve kind of real world problems that probably don't need, would do better with AI, but unfortunately we're not there yet.
Did you get the non-artificial, the real intelligence part right first?
Hey, I will just settle for people not faxing things still. I mean, for that is our good walk before we run on some of this. It's a great question, and I think where we're going to see it first is on the voice side. We've looked at a few companies in this space, is in that customer service administrative side. The data are fairly clean, and we can write, with the codes are written of how to do that, and so we are actively looking in that space.
Now, I have additional questions, and if this is a question, or if I ask you a question that's going to come up in a subsequent slide, by all means, I'm happy to defer to Leah, raising that question. But we have a question around: do you have any requirements as you look at companies who deal with health data around their privacy practices? We have been working with a lot of organizations and have members in the health plan, the provider space, as well as in the digital health space. And there are considerable concerns around, apps, for example, not having really good digital privacy, health privacy practices in place. Are there guidelines that you have or criteria that prospective investment candidates need to meet with respect to health data privacy?
Yeah, so I think that it sums up, even when I look across the portfolio that's up there right now, how a how a Waltz Health that is looking at consumers helping shop for lower priced drugs is going to have different privacy rules and diligence than an Abacus Insight that is doing master data management for large health plans, like that, who's enormous amounts of data there. So first of all, every company has different guardrails and different diligence that we do on it. But as an investor, I'm really listening for a few things on the management team to talk about. One is transparency, that they are upfront in their business model and then with their customers of how they're going to be using that data. And where we get sideways in diligence with companies is, it's an oncology company that we're not affiliated with. In fact, it was a number of years ago, so don't try and figure out which one it was. It was, in fact, not even around anymore. But the oncology they essentially were looking at how they were engaging with oncology patients, and they were very clear about, like, it's for the patient, it's for this X, Y, and Z. We have the oncologist involved, and I was like, okay, great, that's really aligned with our model, because oncology patients need more support, caregiver support, and all these things. But when I open their financial statements, it's all drug companies are their only customer. I was like, which is fine, but then tell me on the first page that you are a pharma, sponsored by pharma messaging that is going to improve the patient's, we hope improve the patient's care, but there will be pharma messages in there. Because then I know kind of what, so I don't like surprises like that. And I feel like our world is becoming savvier about those types of surprises. The data rights have to follow the contracts. And so I think that's the first thing is, if you're a DTC, if you're a pharma sponsored, if you're health plan sponsored, there's a lot of really good business models out there, but have consistency in your messaging and your data rights across all of that. And know that when people like me get into the financial model and your data rights don't match how you say, I'm going to be making $10 million off selling data rights 2 years from now, and you don't have those data rights in the contract, that's a fundamental flaw in a company, and it really shows me that the management team isn't watching those. So that's a business case. Now there's just intense security, PHI, and we are looking for significant knowledge of how they're writing their, the cybersecurity insurance, and depth of knowledge of their advisors in that space. What tests are they doing? How are they reporting that to the audit committee, et cetera, in terms of that security side? Because we've lost a company. If an early stage company has a breach, it's very hard to recover and regain that trust. So that's kind of the business side, and then the a bit on the security side. But it's not a, hey, they can't share data, or there's some hard and fast rule around that. It just, I need the business model to line up with the rights they have.
And for them to be transparent about that being
yes, exactly.
Their business model. Right. Thank you. I appreciate that. We'll let you continue.
Oh, this is so, I love the questions though. So please keep them coming, Denny.
Well, you'll probably end up having about 20 minutes of presentation and about 40 minutes of questions.
I mean, really, this is the presentation. I mean, people show up here to have, and again, I have the, it's the privilege of being able to have these discussions when no one is actually raising money from me right now. And so I can be more candid about being like, no, this is really how I would do that. So,
okay, thank you.
So, but I'll show a little bit of data about what's going on in the market right now. So the reason why you are seeing so many new logos when you're doing a market landscape and you're like, I've never even heard of all these companies. Where did they come from? This is one of the reasons why. The massive amounts of venture capital and private equity have gone into the industry, all industries, over month through 2001. And so what that has led to is increase in marketing spend for even very early stage companies. So it is hard to discern what companies are truly offering what, partly because they all use the same words and same buzzwords. So, but this is fundamentally the change, and where you would probably see it if you're at a larger enterprise or a hospital or a health plan is you've probably lost employees who've been poached by startups because they've received this type of venture capital. You have also had probably more vendors calling in than ever before because of, again, this uptick in venture capital trying to fund innovation in these spaces. For me, what it means is that there is a lot more venture capitalists out running around. And there's some tourists that have just come into the healthcare data space. Some of them are doing a really great job, and there's some that are, I would say, will probably have some challenges in the next few years as companies that were funded are going to struggle to make that next round of funding, to make those that haven't hit some of their traction numbers. So this is 2001. This is what's all led up to, what I called the gold rush. Very funny, which was obviously named 6 months ago when Denny and I talked about doing this. So as we go to what the 2002 numbers so far on the next is, it's tempering, and I think that's, we were just talking about another slide that I was creative with, whether or not to use the word volatility, and sure, it's there are, I would call that more the public markets. In the private markets, which is where private equity and venture capital we play, it's tempered, and there's more caution around where we're going to invest. The deal count is down. The deal values are still, they're a little down, but you can see the early stage is still doing fairly well in these counts too. So again, especially in healthcare, and we'll get to those numbers in a minute. But this again is overall where quarter over quarter what we're starting to see Q2 shape up. But and it's also, before we go to the next slide, if you look at what it looked like in 2017 and the numbers, and you look at where we are in 2022, let's just not forget, we're tempered. It is still a lot of money being put to work in these markets. And there's going to continue, without them able to exit to IPO, we're gonna continue to see those companies receive venture capital. So I'll go to additional trends as the next slide, and it says, and this is I know it's kind of a financial term, but there's a phrase called dry powder, and dry powder means, when you're talking to a venture capitalist like me, who is saying that is the amount of money we have to put to work in the coming years. It's money that isn't it's just sitting. You wouldn't really call it the balance sheet, but it's sitting there ready to be deployed. So when I see that number start to drop, that's when I'm starting to say, okay, there's a real pullback. But people are asking me, like, oh, are we going to see a big drop in venture capital? Are we going to see a big drop in private equity? This is suggesting that it's not going to happen. We're going to see more discernment, which we'll talk about a little bit, in which deals are being backed and what diligence is being done. And companies may only get 2 term sheets instead of 8 term sheets, and they're not closing 2 weeks. They're going to take the normal 3 months to close. That's where we're going to see the change, to go back to some of that discipline that some of us never left, but it is that sorting through is going to happen, and already has started to happen.
Jessica, the increase in dry powder of yet to be invested capital, is that driven by on the demand side, there are fewer good companies, or is it driven on the supply side where investors are saying we're looking for higher levels of assurance from the companies that we may be getting a flood of companies, the same number of people wanting to get investment, but we're much more careful about it, versus we're seeing fewer people coming through the door?
So So Danny, we need to go one level up to essentially a pie chart of where we're getting our money to invest. And those are coming from pension funds, corporate venture capital, corporations, very large institutions that want to take bets in a risky area, which is private equity and venture capital. They are seeing that compared to public markets, compared to real estate, compared to some other large entities where you put your money, like if you're thinking of your own portfolios, where are I putting money? They still want to put money in private equity and venture capital, because so they don't usually get down to the nuance level of, is there enough companies? Are there great management teams? It is usually, are the public market, what is going on in the public markets versus the private markets, and can I make money in the private markets? Is the money in the private market something that I'm going to be able to see a compelling return on versus the public markets? And so that nuance is actually what's leading to some of this dry powder. It is more kind of one level up of how the markets are acting right now. And how the markets are acting is there are companies that are very large. You think of so something that's in the news right now. So Iora was bought by One Medical. Those are fairly, and now is bought by Amazon. Okay, those are very strong transactions to support our industry, to say, hey, you can invest in private equity and do well in these markets. So I'm not trying to dodge your question, but really just say what we're seeing is compelling is that there are returns and interesting exits in the healthcare space, in the healthcare data space, that are making it so that the people who invest in the venture capitalists and the venture capitalists invest in the companies, that chain is working. And we want that chain to continue to be working. I should have started with that. That would have been a much easier explanation.
Well, to see the big deals that we're seeing now is validation for the deals that preceded that, and that's an important signal.
Yeah.
Thank you.
Unfortunately, what we're seeing now is that the IPO, so the little companies, and they get to be big, and then many of them will do an IPO, or not many of them, some of them will do an IPO at the end to fundraise. The IPO market and the public market, it's very difficult for a healthcare company or any company to get to IPO right now. So we're going to be seeing some of these later stage companies just be privately held longer.
Great. I have a question for Bob, who asks, I've spoken to many early stage HIT companies, and way too many seem like, quote unquote, a technology in search of a problem. Given your comments and the dry powder situation, do you believe there were too many investments that didn't get the discernment that your company applies, that there was money placed in companies that were, as we talked about earlier, technology in search of a problem?
On the next slide, let's go to digital health VC trends. So we see that pop in 2021 and how much capital was put to work in that. And I'll agree. I think there were buzzwords that if you could use them, in-home care delivery, the words come and go. What they're going to be. A few years ago, there's lots of attention paid on the social drivers of health. So if you had that in your pitch, you'd be more. A few years before that, you wanted, we can go through them all the way back. But it does. There were more companies that, like Bob was just describing, had a technology searching for a problem, products that were not platforms, but they really were just products. Those I saw more of those funded in this rush over the last few years. So those management teams hopefully are going to be pivot very quickly and be able to find their fit in the market, they're going to be able to get that proof of concept and get what they need in the traction very, very quickly, because having a great technology, it's great, it's wonderful, but that's especially in healthcare services and healthcare IT. Solving the problem is what's going to win, not the best technology, which is hard. We all love great tech.
Well, we've also seen a lot of great tech thrown at problems where it compounded the problem as much as it resolved it. So
absolutely. So
we
Denny,
really
I call it the mac and cheese test. So I'm originally from Nebraska, so there's a lot of mac and cheese in Nebraska. So in the mac and cheese test is, okay, is this intervention? If you just bring mac and cheese to somebody's house and have a 15-minute conversation with them every single day, or you do this intervention, is the intervention going to beat the mac and cheese test? So because there's just also a component of this human contact and meals and food and that improve an individual's health and wellness so much that we can do a lot of interventions, and there's still that human contact that is so important. And so that's often why we also don't see, that's not a technology solution. Helping somebody get a ride to church every Sunday so they can still participate in their community, that could maybe trump a technology solution that and not always, especially as we get into these big problems of infrastructure and pricing and how we're going to distribute drugs and things like in pharmacies. Those are all the big problems we need better solutions for. But at the individual level, it does sometimes come down to that, and we need to balance those two.
Thank you.
So, I think this is just kind of showing this this 2021, we're getting back into there's still very strong levels in 2022 so far. If you look at it, our first half of 2022 is still beating almost every year up through, well, not exactly, but 2019. So, still a lot going on in innovation that is venture capital and private equity backed in the market. So again, you're going to continue to see more logos, more transactions happen going forward. I'm pausing just for a minute to see if there's any questions on that, Denny, or if you want me to dive in any further on that.
No, I think we should proceed. I have a few other, but they're my dry powder questions. So
fantastic! That's great. So if I'll look at the discussion, and I'm going to run through these. We can dive in any deeper on any of these, but what, as an investor, when a company is approaching me, what am I really looking at from the data perspective? And we got this a little bit earlier, which is, how are we looking at this, with data protections? What I want to see within the CEO is first of all, a very healthy respect for the data. And there's just because I've seen some teams come in and pitch, and they're fairly cavalier about data especially in the early stage. I see this more often when companies are coming from consumer goods, consumer packaged goods, or they're coming from other industries. Very rarely do I see seasoned healthcare executives being cavalier about healthcare data. And I know that's what this webinar is full of. And so what a good combination is, when I'm looking at a team, I'm looking at hopefully there's a combination of some very forward tech, but has that seasoned executive on the technical team, so that there's a balance of those two that are rolling it out, rolling out the data strategy, the data tech. That is I'm looking at the team first, and then I'm looking at secondly, I'm looking at the contracts. And what I'm looking for are the data rights. If there's data revenue coming in at some point from this company, are the data rights that they can sell that data in the contract somewhere. And if they're silent on it, that is also, if they're silent on it, when is that going to come back? And do we actually, when is that going to have to be addressed? And does the company have a plan for that? That is a, I think very few contracts are silent on things. We're savvier than we were, or as an industry, we're getting better at, addressing these issues, but, kind of going back to those. So I'm looking at the team, looking at the contracts, and I've already talked about it, and then I'm looking really at the financials. Does the financial model align with what the tech team is telling me in terms of where they're going to make money, and does the tech team have that built in terms of the alignment of, okay, the road. So what I'll do is I'll pull down a roadmap, their tech roadmap that I've gotten from the technology team, and the roadmap of what sprints are they doing and what are they going to hit, and then there's usually a product launch, and then I go to the financials and I see if that product launch date revenue is lining up with when the tech team is. And again, I'm just looking for consistency across that that healthcare deal of how they're doing their tech. And again, that's a lot of that's involving the data side of it too. So that's a bit on the first point. Again, what it really comes down to is these are often early stage companies. They're figuring out their strategy. What I want to hear them say and be just very serious about their approach to this and how much it matters, and that it is different than other industries.
When you look at an early stage company that has a compelling business proposition, is transparent about how they use data, how they engage customers, what it is they're really selling, how early in their evolution can they come to you? Can they come to you and say, this is our target market, this is our data strategy and our technology strategy, here is our team, seasoned team, we are just getting ready to go to market, but we don't have revenue per se.
Yeah.
And what, as a company, as an entrepreneur, do I need to get far enough into the revenue space to have a realistic shot? Or can I go to a venture capital partner as an early stage, even an angel partner, and say, we've got all of these pieces that we're transparently presenting to you. We're excited about it. We have prospects, but we don't have any deals. Right. How do you respond to companies like that?
So where each investor and each fund has a mandate of the stages of companies they're allowed to invest in. And finding out that information as quickly as you can is very important, because then you're not wasting either one time. So there are investors who won't invest until there's 10 million of revenue in a company. Obviously, complete misfit to that company that was just described. There are companies that say, hey, I'll look at those early stage companies, but I need to write $10 million checks. And, that's hard for a PowerPoint company to, company that early. Do they need $10 million? Do they need $2 million? Like that? That's where some of that discussion comes up. So I think, for Echo Health Ventures, we do look at we do fund, that early stage company at the NewCo. We require, though, if we're going to invest that early, that we're going to see strategic fit, that we can really help the company that early. That's we're stage, as again at the beginning I said, we're stage agnostic. What typically you're seeing is companies that early are looking at early stage funds to support them, and then they're going to come to larger venture capital funds, and then they'll go to private equity funds, get some mezzanine financing, IPO. Like there is a size of fund that you would typically go to at different stages.
Great. We have another question from Janice, who asks, and this is a big deal in healthcare, at least in our health data space. you know, we're seeing FHIR, Fast Health Interoperability Resources, as a framework for building APIs that connect systems and enable a higher degree of interoperability. Are you seeing FHIR solutions presented to you? And again, confidentially, we don't want to ask you for company names or anything like that, but are people companies coming to you with FHIR-based solutions that are ready for market, or do you see those as happening over the next year or two?
Yeah. I don't think it's a real phrase, but is there like a phrase called FHIR ready? I don't even. that's
we
where I
use
feel
that phrase, actually.
Okay,
We do use that.
It's kind of the ready, aim, fire. It's like fire ready. You know, then we're gonna. That is a. So if I look at like our portfolio company, Abacus Insights, that is a large. You know, essentially they do outsource master data management for health plans and providers. They have some of their customers that are, you know, preparing for FHIR, want FHIR APIs and are teed up to go. And so they have some of those capabilities and a true belief of the strength of those, of FHIR and how it can change. And that's partly because the Cambia and the CIO is Laurent Roteval is a FHIR, you know, a champion, which
evangelist,
is
right?
I'm sorry, Dan, what was that?
I said he's an evangelist, definitely.
He's an evangelist. That's exactly right. And so, so you know, we're responsive as the more evangelists are out there in positions of buying power, that we're seeing companies start to react to that. You know, so yes, we are seeing it more and more. I tend not to invest in deals that would come to me and say like, we're a FHIR solution. I want to hear companies come to me and say, we are going to, you know, interoperability solution for this use case. That's a little, that's more compelling as a company. And it gets back to a question that I can't remember who asked, but which was hey, we're a technology looking for a problem. There are lots of problems that FHIR can solve, but we do want to make sure that the problem, it's not just a pipes or a technology, that you really do have that full company built around it.
Okay, thank you. That's my questions for now.
Oh, okay. So, you know, what if you haven't been through this process in the past? You know, what diligence is done in deals, and I think what is it's different than customer diligence, and it is different than, you know, than a sales pitch. Diligence is done on whether or not the shares in that company are going to increase in value, not whether the product works. And I feel like there are times that data-heavy companies come and explain to me the product, the services around that product, and they say, and that's why we're going to be a great company. And that actually is one aspect, but what I'm looking at is the team going to be able to navigate through rough waters when those rough waters hit? Is there a market size for this problem that is big enough? Who are the competitors in this space that are going to, you know, even if they're just promising we're going to build it 18 months from now, as some of the EMR vendors do, that's going to be you know, really hurt this company. And so again, looking at that entire, how are you going to win the market is really what I'm looking for in my diligence, not does the product work. And I feel like I hurt entrepreneurs' feelings sometimes because they want to show me a demo in the first pitch, and I almost never do a demo in the first pitch. It is, in fact, I don't usually even, I just assume the product works. I want to hear about the market. I want to hear about the team. I want to hear about all those other aspects of the deal, not just the product. And that is again, the entrepreneurs who, that's just a tension point sometimes. We keep coming back to that. You know, we're looking at the corporation and the value of the corporation and the strength of it, which the product is one aspect.
Well, it's often the case in my limited experience, but where founders have pride of authorship, and authorship is not necessarily what an investor is looking for. They're looking for is, you know, how many people are going to buy the book? How many people are going to read it? Is it a good story? You know, does it, and sort of starting to to introduce you to the demo is a little too granular and a little too, it's insufficient to make a determination about the value of a company.
Yeah.
But it's interesting. One of the questions that that comes to my mind is the bar is getting raised on companies that are digital health companies that are selling into the payer segment or the provider segment, who are in and of themselves conservative organizations. And the ability of these companies to approach these organizations, we often get asked, I'm an entrepreneur, I can't even get into a hospital or a health system or a health plan. I can't show them how my solution works. What is some of the advice that you would provide entrepreneurs who are, let's put aside the ones who just want to show you the demo and the ones who have something, the ones that have something that's more compelling, but they can't get past the front door. How does a company like Echo Health Ventures or others help these companies that you believe in get a toehold in markets that might be difficult to penetrate?
Yeah, I think this is one of the the nomenclature of marketing is a very it's a very strange term because there is an aspect of what you're talking about is getting into that front door is marketing. But what then some people think of is, oh, that means I should buy advertising, and that means I should buy webinars or sponsor that they really want that. And I think the savvy entrepreneurs, so let me answer the question first and I'll get to how Echo responds. The savvy ones are really like, look, I know my audience is only a few thousand people in terms of that, and in order to get their attention, how I get their attention is through a very simple value proposition that they can repeat to their team. And I think that's the real first step, especially of these startup companies, where there is we talk about the elevator pitch, but to be able to say, when you call on, and I can do this, you can call into a CIO or someone in the organization and say, hey, this company is saying they can do a 5x ROI on this problem. Do you have that problem? And they say, yes. Well, can I introduce you to the company? That, whatever that first thing, that ROI number, that value proposition, finding out if they have that problem, you can do the introduction. Like that is the hook that I think some companies don't spend enough time making sure that hook is succinct and repeatable, and that you can email it in and get a quick response on. That's a huge elevator pitch, hook that can be, and good savvy, again, I'm using the word marketing in a very narrow way in that product marketing space. How Echo brings value is we are a strategic investor. We work with companies often who have payer somewhere in their ecosystem, which is almost every healthcare company out there, that want help understanding how to do those pitches, how to get in. Once they're in, how do they navigate through these 18-month sales cycles? Those are where Echo tries to help each one of our portfolio companies. We have our investor team, but then we also have a whole nother team called our Echo Health Advisors that every day work with our portfolio companies to help them get contracts, help them know where to pitch, when to pitch, how to pitch, and so that neither side is wasting their time. But I think one part of that is really understanding that, getting that hook right first, and then making sure you've got the right people helping you navigate into them.
One of the things that I remember from, and I'm sure in many cases it hasn't changed much from the late 90s, the early 2000s, the first rush to the internet, was that, the teams were often characterized, the management teams were often characterized as very young, very good in particular aspects of the work. You'd have a sales guy, you'd have a tech guy, you'd have a marketing person, a business development person, a CFO and a CEO. Are you seeing changes in the compositions of teams that are coming to you today from, say, 20 years ago in terms of expertise, I don't want to say age, but seasoning? Are you seeing teams that are more seasoned today than years back, or do they look like, the same, do they look largely similar to those that we saw 2 decades ago?
Over the time I've been doing this, which again, yes, you're right, 20 plus years, the teams are fundamentally different than they looked a while back. There's a company called Headspace, and the CEO is Russ Glass, and tremendous respect for him. When you actually look at his background, that isn't a CEO our industry might have been able to attract a number of years ago. And I think that of just a scaling tech background, but we actually have it now for some of these companies. It's actually a behavioral health scaling tech problem. How do we get the number of visits we're going to need? How do we get the engagement that, again, great tech CEOs can bring to the table? And he's a wonderful example of, I think, how that's been able to happen and bring some of that expertise. That we just didn't see that a number of years ago, where we would see tech consumer CEOs be very successful in our industry of healthcare and healthcare data and healthcare infrastructure. But I also see it in the earlier stage teams now. I think what I said before about that balance of, hey, healthcare data, and you have an interesting tech background, and you've got sales experience. Let's all three come together and do this. That diversity of teams is, I think, what is accelerating some of the innovation we're seeing, where we really couldn't attract some of the more compelling talent on the tech side, I think 15 years ago. I also think it's a change in our world. People want to work for organizations at a higher rate where they feel they're adding value. And while brownie delivery may be fun code to write of how to do faster brownie delivery, actually helping someone get their chemotherapy at home is just it's a different type of job, and we all know that because we're in this industry. But that is compelling, I think, also more execs to come into healthcare, and that is a industry-wide, greater than our industry movement.
Jessica, we have just a few more moments left, and I wanted to be sure. I have one more question. You have other points on your slide that you were going to raise. Which would you like me to just?
We've covered so many of them today.
Okay, good. Let me just ask this last question of you. Janice asks, are health equity and accessibility priorities when you vet a company, or are they just another pesky buzzword of the day? If so, what do you look for in these areas?
So if I go up to our, I don't know if we want to go back to slide 9, and I look across our portfolio, I expect to see, let's go through the rank. I expect to see an accessibility of every company I look at. How are you accessible to all? We look at in America, to all Americans. This isn't just for people in Silicon Valley or Manhattan, but how can a mom who's working 2 different jobs still have this be an accessible solution for them? And that isn't just the social drivers, social drivers of health, social equity, justice. It is a fundamental. I'm looking for CEOs who are seeing the market as everyone across. And then we do a specific focus of where are we when we have underinvested in markets, when we have especially in the Medicaid space, there's more innovation that needs to be brought. So I would first, coming back to the top point is I expect every CEO and management team to have this be a part of their talking points. That's part of who we are. We represent Blue Cross Blue Shield plans. They represent Medicaid. They are often the local insurer. That is, that our themes are very consistent along that. I can't speak for other investors on that. I can't speak for but it's very important to us. And they're not just buzzwords, they're how we invest. And then when I look at our portfolio, we have companies like Eleanor Health, which is addressing substance use disorder in a fundamentally different way. City Block, same for in the Medicaid space. Wildflower, which is trying to address an awful problem, especially in the African American mortality rate with maternity death. And so in their women's health company, it is those, but we expect them to be infused in every company. And I think that's the way we actually fundamentally get to change, is when it isn't, they aren't buzzwords, they're just the expectation of, that you're dealing with how we're dealing with a very broad population. And unfortunately, COVID brought out many of the social justice issues and the public health issues that we need to be having a top priority across all of these companies.
Well, Jessica Zeaske, Echo Health Ventures, thank you so much for joining us today. It was a delight to talk with you and to have you present your insights to our audience. And I want to thank everyone in our audience for setting some time aside in your day today for joining us. We know you're busy, but if we have a few moments, we would appreciate your taking a survey that we're about to put on the screen, and that you join us for upcoming webinars with MHDC and learn more about our company and our mission with respect to health data. So thank you all for joining us. Have a good day, and we will talk soon. Take care.